Good day, everybody. Today we're back for another segment of Coffee with Cathy. I really appreciate you all tuning in. We have an exciting show today, so I look forward to sharing with you all of the information that we have on the Medicare Savings Plan and how to handle it with Laura Cruz. But first, I want to remind you that if you want to see information on this show, please call my office, 860-240-0579. And why don't we just get started? Laura, why don't you introduce yourself? This is the constituents from the 19th District.
Wonderful. Well, my name is Laura Cruz, and I am the Director of Benefits Access for Senior Resources Area Agency on Aging. We are one of the 5 area agencies on aging in Connecticut. So Senior Resources handles the Eastern Connecticut side. So we have New London County, Middlesex County, Windham County, and for some reason we have 5 towns in Holland. I don't know how that happened, but we do. And
that's a pretty big area.
It's a huge area. We're 56 towns. My other sister agencies, my colleagues at the other AAAs, while their towns may not be as massive as ours, they obviously have a higher population in smaller areas.
Right.
So that's how we were divvied out. But we're all mandated to exist under the Older Americans Act. Our agencies are required to fund some of the Older Americans Act dollars by virtue of sending in requests for proposals. Things like transportation, dental services, adult day centers. We provide some funding to senior centers.
Through federal grants?
Yes, through federal grants and funds. But we all have other programs as well. And all 5 area agencies on aging administer what's called the State Health Insurance Assistance Program. In Connecticut, we call it Choices. For some reason, we had to be different than all the other states. But you may know us by Choices.
Yep.
And we have a very complex system that we have because the Medicare program is so complex. I am the regional coordinator for the program, so I am in charge of training volunteers as well as in-kind professionals to know all about and more about the Medicare program and other forms of financial assistance programs, especially the Medicare Savings program.
So the Medicare Savings program is a piece of the Medicare program. It's not the entire program.
Correct.
And the Medicare Savings program has received some statewide attention because it was cut back, not eliminated, but cut back to the federal requirements?
Correct. Every state has the Medicare Savings program, but the federal government gave some leeway to say it is up to each individual state on how they want to run the program. Many states basically decided to stay with the federal mandates of lower income and put an asset test to it. Back in 2010, Connecticut decided to eliminate an asset test, and they raised the income limits by a lot, frankly. But it allowed many people to access this program. And through the years of course, the federal poverty limit that raises each year, as well as just cost of living, we've seen a trend since 2010. This program has received increase. Now I think
increase in federal dollars or increase in participants?
Participants, because they increase the income limit that allows individuals to qualify. So with these cuts, it is going to affect, I believe the latest total was over 126,000 people in Connecticut.
So we at the legislature rescinded those changes, so now it will go back to the way it was, but that has only fixed it for the current fiscal year that we're in, which ends on June 30th. We still have to look at next year's funding mechanisms. This program's not only for elderly, it's elderly and disabled?
Absolutely. If you are on Medicare, whether it's due to obtaining Medicare due to a disability or age-related, if you qualify income-wise, you will have access to this program. And it is a wonderful program that helps individuals financially.
And what does it help them with?
Okay,
Because
perfect.
a lot of people don't know what it helps them with.
And it can be very confusing. So every state with the Medicare Savings Program, it's broken into 3 different levels, and it all depends on what your income is that will determine what level of program funding you will have access to. 90% of the Medicare beneficiaries on the Medicare Savings Program is on what's called the Qualified Medicare Beneficiary part of the Medicare Savings Program. If you qualify, you'll be mailed through the Department of Social Services a gray Connect card that says the Department of Social Services State of Connecticut Connect card, and it contains a client ID. What this program does is Medicare is not free. There is always some form of a premium or copays or balances that are always left over. The Medicare Part B premium is currently $134 per month based on income. Obviously, if you make a lot more, you may be required to pay a higher Part B premium, but the standard premium is $134.
Okay.
Most individuals, that money is taken directly out of their Social Security benefit to pay for their medical premium. In essence, by virtue of being on the Medicare Savings Program, the state of Connecticut will pay that for you. So the state of Connecticut makes the payment to the Social Security Administration. Therefore, you get your full Social Security benefit without any deductions. That is a huge savings for seniors because that equals to about over $1,600 a year just in a Medicare Part B premium. By virtue of having that Gray Connect card, it also protects that Medicare beneficiary from approved Medicare Part A or Part B deductibles, copays, or coinsurances. So it's almost like having a supplemental policy in addition to your traditional Medicare that offsets the costs. You pretty much have 100% coverage through Medicare.
So does that help out with pharmaceutical copays? Is that one of those copays that it could help people out with?
It does help out, but it comes in another form of a benefit that you're automatically entitled to by virtue of going on to the Medicare Savings Program, and that is called the low-income subsidy. They're 2 distinct programs, but it's almost like a two-way street with the Medicare Savings Program. By being approved by MSP is what we call it.
Yeah.
You're automatically entitled to the extra help. There's no additional paperwork you need to do to get on that. And what the extra help does is it helps you with whatever prescription drug plan you have through Medicare, whether it's a standalone Part D plan or you chose to get your benefits through a Medicare Advantage plan with drug coverage, is the low-income subsidy assists with your Part D, is what the prescription drug plan is called, the premiums, but it also has a lot more to offer by ways of it eliminates a calendar year deductible that you may have with your prescription drug plan. It will lower your copays to no more than $8.35 per prescription.
So no matter what the prescription is. So say you have a prescription that is required and the prescription may cost $300.
Correct.
You would not have to pay more than $8.35.
Correct, as long as it's on your plan's formulary, which is the
Right.
caveat.
Well, if it's on the plan's formulary, even if it's not on the plan's formulary, if the doctor has said that your formulary does not fit your particular disease, does that go beyond the formulary?
It does not. You would have to work with your prescription drug plan in attempt to get a formulary exception. The great thing, though, with someone who's on the low-income subsidy, they have what's called a special enrollment period throughout the entire year to change plans. So if you enrolled in a particular drug plan and they were just unwilling to work with you to try to get certain drugs covered, you can say, well, thanks, but I'm going to go look around.
Right.
And by virtue of having that low-income subsidy, we could assist that client with enrolling into another plan that we know would cover all their prescriptions.
Oh, okay. And so you don't have to wait until that once a year
Correct.
Enrollment period. You could do that 2 or 3 or 4 times or 12 times
Absolutely.
in a calendar year
Right.
if you so had to, based on your needs, your medical needs.
Correct.
Now, many people, how many people across the state participate in the Medicare Savings Plan?
Well, as far as exact numbers, all I can tell you what was received from the letters we received from the Connecticut Department of Social Services was over 126,000 people, from my understanding, are being affected. From my understanding, out of that 126, I believe over 88,000 will lose the benefit completely, and about 26,000 are going to move within the levels that are there. So if you lose the highest level you can receive, the QMB, you'll still get your Medicare Part B premium paid for, which is great. That's the $134. Yep. And you'll still have access to the low-income subsidy when it comes to your prescription drug plan. But by virtue of losing the gray card, you're no longer protected from the Medicare Part A and Part B deductibles, copays, or coinsurances. You're going to have to figure out, can I afford a supplemental plan, which they're very expensive.
Right.
Or if you're in a Medicare Advantage plan, am I able to afford the copays to go see specialists? You know, some of those are $50 a piece every time you go see a specialist. And, you know, our seniors and our older adult disabled population, they're going to have to determine, can they afford those copays?
So a lot of people, when they talk about the SLIMB, QIMB,
Yes.
and MSP, it's got a lot of acronyms.
It
and
does.
It's got a lot of different moving pieces to it. Essentially, on this, without having, this was a benefit that was at 220% of higher than the federal income level. Is that
I believe
about
it's up
what
to
it's-
255, which is
Okay.
the highest level, the ALMB,
Okay.
is the highest level of income someone can make. And from my understanding, it's drastically reduced. It's going down if it goes through.
If it went through the way,
Right.
if at the end of this fiscal year, it goes down. Now, many people think that this is something that people haven't worked towards or they might not deserve, but this is really, could be an elderly person living just on Social Security, making $14,000 a year, and without this benefit would have to choose between prescription drugs, going to the doctor, or eating.
Correct.
Is that something that you found?
That's a very clear assumption, yes. And we fielded many phone calls, and when I'm out and about in the community doing presentations about that, one of the first, I don't want to say question, but the comments are made is, I now will have to decide food or can I go to the doctor that month?
Right.
And that's very distressing. That is just stuff we don't want to hear.
Right.
I'm not going to repeat all the phone calls that we've received, but some of the information our Medicare population was giving us is just truly so sad, so
Right.
sad. Many feel that they may lose their homes because now they're going to have to put more money into their medical aspect. And
they may have paid off their homes years ago. Some of them rent and some of them are homeowners, but they may have paid those homes off
Right.
and are still paying the sort of every day expenses that we all pay. And again, only with that Social Security payment. So if they owned their own home, they still have to pay taxes.
absolutely.
They still have to pay for heat and electricity. They may have a cable bill or not.
Right.
And they just paying those can add up very quickly to, half of that Social Security pay and
Right.
still have to buy food.
Right.
And so that's the essence of what's going on with this particular population. Now, it could be some of our developmentally disabled folks could be getting the Medicare Savings Plan also. Did you receive any phone calls from those families or those folks?
Sad to say, yes. Within a 1-week period, our office fielded about 300 phone calls in 1 week that came in just because the letters were going out as a notion saying this may happen.
Yep.
And that was when it was going to happen as of January 1st. Again, those types of phone calls, young individuals who just became disabled, whether it was due to being hurt on the job or,
car
as
accident.
you mentioned, exactly, maybe individuals that have developmental disabilities. And these are programs that for some help keep them alive.
Right.
These much needed medications that are sometimes $5,000 a pop.
Right.
It's unaffordable.
Right.
And those types of medications would be very unaffordable for those that even if you don't qualify for the program.
Right. And some of the developmentally disabled are living only on Social Security,
Correct.
trying to stay independent. trying to stay on their own, and this is something that would stop them from being able to be independent, and it would also put increased burdens on their family unit also.
Loved ones. You may find loved ones needing to pitch in to
Yep.
help mom or dad or brother or sister, aunt and uncle with these types of payments that they'll now have to make on a
Right.
monthly basis. It's an awful snowball effect of what will happen. And this will affect everything from seniors or older adults who live in senior housing. If their whole rent will have to be reworked because now they'll have more medical expenses, which, yes, will lower their rental payment, but it's not a wash by any means.
Right.
So the effects will be felt long-lasting, in my opinion. And as well as, how do I want to say, it doesn't happen overnight if an individual no longer qualifies for the program. Unfortunately, your Social Security benefit will be attacked for 1 month, if I
Right.
can say it that way. It's not an overnight notification to the Social Security Administration. So what happens is the state of Connecticut notifies Social Security they'll no longer pay the Part B premium, but that's usually 2 to 3 month lag time before all these entities are notified. So what happens is it's on the Medicare beneficiaries responsible, their shoulders, that those past due, back due premiums will then come out of their Social Security benefit.
All at once.
All at once.
Yep.
And then from going forward, that point forward, it will just be reduced by the Part B premium, which is the $134.
So many people might think that why is Connecticut more generous than other states? But this has been going on for almost a decade.
Right.
In 2010 was an increase.
Yes.
So what would be your response when someone says to you, why are we different? Why is this something that we should do?
Well, the biggest thing that always comes back is it's more expensive to live in Connecticut.
Right.
It certainly, anything, food, gas, heating expenses,
Yep.
always seems a little more expensive in Connecticut.
Well, it's certainly more expensive than Florida.
Sure.
Because they
but-
don't have a heating expense.
Correct. They definitely have cooling expenses, though. I don't have a great answer for you as to what was the original thinking of raising the income limit that high.
Right.
Like I said, it happened back in 2010. We as AAAs, we were astounded when we saw those income limits come through. We're like, wow, that is amazing. And for us, it was a win-win situation because the amount of people we could say, do you know you qualify for this program? Do you understand how it's going to help you? For people who never enrolled into a drug plan because
Right.
I don't take drugs, I don't need them, further down the line, what happens? You become ill and you may
Right.
now need prescriptions. This type of program is their back door into getting into pieces of the Medicare program penalty-free, whereas a person who doesn't qualify will have a penalty, possibly lifetime late enrollment penalty. And so it's nice for us to be able to give that information that, this is not going to pertain to you. We're very worried as far as the social services side if the funding is not restored beginning July 1st and onwards.
Right. Well, it's all set all the way up until June 30th.
Wonderful.
But July 1st is essentially right around the corner.
It is.
And so you sense that there is a lot of support in Connecticut for continuing with this program?
When we've reached out to our local legislators and our Medicare population, friends, family, neighbors, they too reached out to their legislators, and I know you've all heard, because I'm sure your phones were ringing off the hook as well. And it didn't take long. I'm proud of our legislators because it didn't take long for them to get on board and say, okay, this is a very important topic and we need to discuss this. Like I said, I've done several presentations throughout my area, my 56-town region, and some of them were accompanied by the local reps from there, and they said, we hear what you're saying. We need to figure it out.
Right. So it was a $54 million fix just this last session, and it was done on a bipartisan basis. The decrease of the MSP program had been in several budgets over the last number of years. It was in the Republican budget for the last 3 years. It was in the governor's budget this year, who looked at it after 3 years of it being in the Republicans' budget, and then it was in the budget that ultimately was passed and signed by the governor. After that time frame, once it got to the point where it was going to happen, people realized how bad it was going to be.
Right.
Both those of your constituent base that we're going to see the decline in resources, and this last winter has been just an awful winter in regards to heating. I'm really glad it's warm today.
I know.
But we have all heard from our constituents, but you also know the dramatic impact that it would have had on everyday lives of everyday people who had, in some cases, worked their whole lives, and now we're either well, I call it young at heart, not really elderly, because I
Right.
think it's really young at heart, not really, my mother would never let me call her elderly.
Right.
So she was not elderly, so, but young at heart and still struggling a little bit to make ends meet. And
Absolutely.
had worked, her whole life and lived on Social Security and had a difficult time sort of making ends meet. In my case, there were 7 of us kids, and so we all were able to pitch in a little bit here, but not everybody has that particular situation. Some people have no family that they can count on to sort of help out.
You're absolutely right, and we hear those types of stories every day. I'm alone. My husband or wife passed away, or my children don't live near us, or could just be family issues to begin with, and
Right.
they're not on talking terms
Right.
anyways. So it is, yes, it's just some of the stories are just absolutely heartbreaking, and I truly hope that Connecticut can come up with a fix, because this is a much needed program for our Medicare beneficiaries.
And again, it's almost 130,000 people across the state of Connecticut that would have been dramatically impacted
Yes.
and have to figure out ways to either pay for their prescription drugs, pay for their doctor's appointments, or
Right.
eat or pay rent.
Correct.
So,
The Choices program through the AAAs, the Area Agencies on Aging, like I said, we've taken many of those phone calls, and we'll do screening processes to determine if they may qualify for other sorts of programs. Little known fact is individuals who may be collecting Medicare due to a disability, there are other programs out there if you're able to work just a little bit.
Right.
And, it's not going to be full-time work, because your disability may prevent you from doing so.
Right.
But we do have some Medicare disabled population that may work 5 hours a week. And if you have gainful employment where you're paying payroll taxes, there is a program called Med Connect, which is Medicaid for the working disabled.
Okay.
It has a very high income limit. There is an asset test. However, it's about $10,000 for a single person and $15,000 for a married couple. But it gives you the benefits of what Medicaid would, and it still allows that person to get the extra help with their prescription drug plan. They'll still have to pay their Part B premium,
Right.
Because the Medicare Savings program is the only program that will pay that. So those are things that, through all the area agencies on aging, the Choices program is doing for the individuals who are calling in. We're just taking our time with them, and we want to get the whole picture, what's going on in your life, and let's see, are you eligible for other programs? And the nice thing is we will provide application assistance as well.
And do you help out with possible employment for people if they're available for work, or do you encourage them to see some of the American Job Centers that are around?
That, and also the Department of Rehabilitation Services, we make referrals there because
okay.
there are individuals on staff that will help individuals who are trying to find employment even though they may have a disability. So, there are avenues for individuals to turn to. It's just the bottom line is, do you qualify?
Right. And many of the people that are disabled really want to work too.
Sure, absolutely.
People
And
like to
I hear
have-
it every day. So and they're so sweet, and it wasn't their fault. It wasn't their fault they got into a car accident or anything like that, and they're just so wonderful.
Or developmentally or intellectually
absolutely.
disabled since birth.
Right. It's simply not what they wanted to happen.
Right.
But hopefully there will still be programs available to them as time goes on.
So what other types of programs do you help out people with through the Choices or the area access agencies?
So as far as the Choices program is concerned, we will assist with Medicaid applications and Supplemental Nutrition Assistance Program, which is the food assistance. We will assist with those types of applications. However, that's not the only thing Senior Resources, as well as the other area agencies on aging, do. They do things like grandparent resources. You could be a grandparent raising your grandchild, and there's some program funding there to help assist with the raising of the grandchild. There's the Caregivers Support Program in the statewide Alzheimer's Respite Program. Those are designed to give the caregiver a rest from the constant caring of someone, and whether it's to pay for some adult daycare or perhaps fund a lifeline, maybe all to make daughter feel comfortable with leaving mom for a little bit. It's just that lifeline around there.
And the lifeline is the mechanism that people use today. We call it lifeline, but there's other names for it too.
Correct.
That allows people to have some help out with the risk of.
Right, or in case mom fell.
Right.
She can easily click that button and it will contact whomever needs to be contacted at that point. We also have a wonderful program called the Chronic Disease Self-Management Program. It's an evidence-based program designed specifically for those that may have chronic conditions. It's a workshop that's given 1 day a week for 6 weeks. It only lasts 2.5 hours, and 20 minutes of that is a break. So, you're looking around 2 hours. But it's a wonderful program to set a goal, an action plan, to say this is what I want to accomplish this week. And then as the 6 weeks progress, you're then going to ultimately, hopefully, come up with an overall goal that you're going to consistently work towards. So we're very happy to offer those programs as well. And anything, please feel free to call the area agency.
Number?
Oh, absolutely. I'm going to give you just the Choices 1-800 number.
Sure.
In a perfect world, it's supposed to connect you to your area agency on aging that services your phone number. That phone number is 1-800. I'm going to make sure I get it correctly because I've been known to transpose numbers. But it is 1-800.
So have I.
It is 1-800-994-9422. And that is an in-state Connecticut number only.
Okay.
So you need to be in Connecticut if you call.
Well, I really appreciate you coming down, Laura, because you've given a whole boatload of information, all in just a snapshot of a moment. But you would encourage legislators to make sure that the Medicare Savings Plan is properly funded?
Oh, I would love that.
Okay, so that's what you would ask people to talk about, and what you've done is provided people a background on why we need the Medicare Savings Plan funded at a correct level. And this was a bipartisan decision, and I actually think we're going back into the General Assembly for an override vote to make sure that we're supporting it. So keep your fingers crossed, and we'll see what will happen.
Absolutely.
And I just want to thank you. And again, I want to tell everybody, Laura Cruz, thank you so much. Senior Resources, 56 towns. Can you imagine? 56 towns. That's
we accomplished, though. We're good.
Yeah. You are good. You do a lot of good work for a lot of people.
Thank you.
And we really appreciate everything that you do. And I want to thank you very much for coming for another episode of Coffee with Cathy. And again, I tell people, if you're interested in any piece of statewide legislation that you'd like to talk about, or a state issue, or even a local issue, if you think that we can get you some information, please call the office, 860-240-0579. I want to thank you all so much for participating in our show one more time, and thanks, Laura.
Thank you.